The Gauteng Health Department is once again carrying out its clinic committee project across its 370 public facilities in the province. The department, which is running the project for a second year in a row, has made a call to communities to nominate their preferred candidates. The initiative aims to bridge the gap between healthcare services and residents, as well as identify gaps in efficiency. Newzroom Afrika's Katleho Sekhotho is in Mofolo, Soweto, at a local clinic there. Katleho, essentially to tell us what more we know about the project and how it has benefited residents so far. A very good morning, Dudu. Indeed, we are at the Mofolo Community Health Center in Soweto, where the Clinics Committee project, specifically at this clinic, seems to be assisting residents in helping them sort of raise their complaints, grievances, compliments to the committee, and and that committee is able to facilitate, communication between residents and staff at the clinic. And basically, what we know from the Gauteng Health Department, which has launched this project this year, calling on community members to nominate their preferred candidates, is that it's supposed to initiate really facilitate conversation between residents who are concerned about healthcare services, as well as the local clinics such as this one. But to give us more, I do have with me Zanele, who can give us more about how this Clinics Committee actually functions. Zanele, thank you for your time. I mean, just take us briefly through how does the Clinics Committee operate? What work does it actually do?
Thank you very much. Clinic committees are the statutory bodies that are appointed by the MEC for Health. They are appointed according to the National Health Act, Section 42, number 61 of 2003. And that part of the National Act stipulates that in each and every facility of health in Gauteng, there should be community representation or participation. And the community participation entails that the community as a whole must identify representatives in the community that will represent them in the clinic, ensuring that there's good governance, ensuring that they address the community needs. Mm-hmm. They have to make sure that in each and every community of Gauteng, there is representation, there is inclusivity, and even when it comes to grievances, they have to be addressed through this community called the Clinic Committee.
Right. Mm-hmm. Now, Zanele, in terms of this Clinic Committee, this initiative, what sort of complaints, issues can a community member raise with the committee, and then how is it dealt with?
Thank you very much. Clinic committees are responsible for 6 priority areas of the Department of Health. That is, they have to make sure that the long queues in the clinics are addressed. They have to look into the cleanliness of the clinic. They look into infection control. They look into security, that the community and the facility management as well, they are secured within the clinic. They check for availability of medicine. So those are the 6 priority areas that they have to overlook. They do oversight on these 6 priority areas. And then, for example, if there is maybe the clinic is not clean enough, the community can complain to the clinic committee. They can raise any matter that regards to the clinic. And then the clinic committee, together with the ward councillor, the CDW, and the health rep, and the facility manager, they are the ex officio member of the clinic committee. The clinic committee consists of the 5 representatives from the community, together with the ex officio. They have monthly meetings where they come into the meeting and then they discuss the 6 priority areas, and over and above everything else that the community is concerned about with regard to the clinic.
Thank you very much. We'll leave it at that. But we will definitely look into, the ways in which community members can engage the Clinics Committee. But Zanele, they're just outlining that it is a platform at which residents can approach the committee and then have any of their complaints or, issues around receiving healthcare services at these facilities raised with the committee and then dealt with by the facility. A very commendable initiative there. Thank you very much, Katleho Sekhotho.